Can I interview you on camera?
Sure, that's fine.
Okay, so I'm going to start with your full name, where you're from, and do you live in Houston?
All right, my full name is Alisha James, and I'm from San Antonio, Texas. And yes, you just asked me, do I live in Houston?
Mm-hmm.
I reside in Houston since 2002.
I'm from San Antonio too.
Oh, really?
Mm-hmm.
Oh, okay.
And then the next question is, what's your employment background? Where do you work now, and how long have you been with whomever you're with right now?
My nursing background started in San Antonio. That's where I got my RN nursing start. I did pediatrics for at least 14, 15 years. Currently, I work at Vitas Hospice, and I've been there 7.5 years.
And it's, how do you spell Vitas?
VITAS, healthcare.
Okay. And you've been there for how many years?
7.5 years.
7.5?
Mm-hmm.
Okay. What is your current title? I'm sorry. And how long have you held this title?
Currently, I'm a nurse manager, so I do it on the weekend, so it's weekend telecare manager, but it's a nurse manager. And I've been a nurse manager since 2005.
Okay. When you started, what were the primary duties and responsibilities?
When I first started hospice, as a nurse manager?
Yes.
As a nurse manager, I was the home team manager, so therefore I was up in the north area, and so I had a chaplain, social worker, nurses, and aides, and a physician that were on my team, so I managed them. And what we did, we went out to the homes, nursing homes, hospitals, to take care of the terminally ill patients.
Mm-hmm.
And so I did that for almost 3.5 years, and then I went into administrator, and I did that for like 6 or 9 months as the what you call it, a DON. That's what would be the equivalent of the DON, the Director of Nursing, for about 6 to 9 months. And then, but my schedule didn't permit, and personal reasons, and I went to become a weekend telecare manager. So then my staff that I currently have now, we're the staff after hours. So we come on in the evenings and weekends. So again, we go out to the homes, nursing homes, when patients and families call in the evenings or overnight.
Okay. And the next question is, briefly describe your formal education. What degrees and or certificates have you earned? What kind of courses did you take? And was a communication course required?
Yes, I started off, with high school. In high school, I did the nursing part of it in high school. So half of the day I went to school, the other half I worked in nursing homes and stuff, because I knew that I wanted to go into some field of nursing. So I started off also at St. Philip's College, and was preparing for classes to go to our Incarnate Word 4-year program. But I went ahead and went to finish my nursing at San Antonio College and received an associate degree in nursing. And then from there, landed a job at Santa Rosa Children's Hospital and worked in the pediatric ICU for years, where I got certificates in certification in CPR, pediatric basic life support, NOWS, which is neonatal life support. So you call it PALS, or you can call it NOWS. And then from there, like I said, I did that for 14 years, and various things in ICU, certification on ventilators and stuff like that. And then kind of did a little bit of end-of-life care in the palliative arena on another floor. So then I know that was preparing me for hospice today. And so, and then once I came to Houston, I did take some classes here and there. But currently, I hold a Christian Counsel certification for Christian counseling for people dealing with grief or with anger management or parenting. And then also doing end-of-life care, certified in end-of-life care certification with that also. And now have taken on what we call a part-time job teaching LVN school. So now I'm teaching pediatric classes, OB classes, and foundations at a LVN school here in Houston. So yeah, lots of things for the career. It's always geared toward nursing.
Okay, so do you plan on continuing your formal education?
Yes, I've just got accepted into University of Arlington for their BSN program, so I can continue to get my finish up and get my BSN, and then go on to the master's program for nurse practitioner.
What do you like most about your job, and what do you like the least?
The least is sometimes the long hours. But what I like about nursing is, to me, is a form of ministry. And so I like volunteer, I like the ministry, I like, hands-on helping people. So I chose that years ago as a young child, always loving to help. So it's kind of geared me toward nursing. And what I love about nursing, you can do all facets of nursing. So I can do neonatal, the child is born and see them through. Then you had pediatrics, and now I did geriatrics, which is for elderly people. So now end of life care is when I'm seeing people leave, and to make that difference while people are going through the terminally ill and they just don't want to go back and forth to the hospitals and stuff. So having them home in their own element, and they've come to grips with their illness, they're dying from the illness, but just making a difference, seeing them kind of enjoy that journey, and realizing that we run around with the hustle and bustle all the time, but when it has to make a difference, you do stop and smell the roses, and you appreciate things. And just to see people come to that end, and families come together and support that person to the end, that's a beautiful thing. Yeah, that's a beautiful thing. So, and then becoming a nurse practitioner, eventually we want to venture out and go to foreign countries and go help. Because nursing, you can do all that. You can go all the way up into administrative, because I've done administrative stuff, but that bedside nursing and just at instant gratification, if you can just wipe someone's mouth, turn them over, just reposition them, and they feel better, you've done your job. Yeah, you've done your job.
In what situations are communication challenges pitfalls or challenges most likely to occur?
In nursing too, the other side of it is a busy job, and can be very stressful if you let it. You have to learn how to have balance, because I've been at the point where I've worked, multiple jobs doing different things where you're multitasking, to where when you, at the end of the day, you realize you have nothing else to give, or you don't have that balance. You don't keep that balance with family and friends and something else to do besides just work. You'll find yourself drained. You'll find yourself burnt out. And so you don't want to do that because you have nothing to give. So you yourself have to have an outlet. Have an outlet and go and have a hobby or do something else besides just nurse, work. Because then, you'll find yourself like, oh, I don't want to do this anymore. But for me, I love the idea